All right, we're back this morning with a milestone in heart care for people on the Treasure Coast. So joining me now, we have Tyler Sherrill, who is a CEO at the Florida Coast Medical Center, and Dr. Amy Eversole, she's actually the Vice Chief of Staff and Cardiologist at the center. So thank you guys so much for being here with us. Tyler, you were here last year, almost a year ago, talking about opening a hospital. Now it's open. Talk a little bit more about the expansion of cardiac care.
Yeah, so as I mentioned, we look back on those photos. August 27th, we were back here on the show with you. That was almost a year ago. We were talking about opening a hospital September 9th. Well, we did that. We opened on time, by the way. But we always knew that our starting points continued to evolve. And so we opened the hospital, but we knew we had things ahead of us that we needed to accomplish for the community. So since then, we've expanded a lot. We've done a lot of things, great things. But specifically what we want to talk about today is cardiac care, cardiac expansion, and heart care. So we've added with some incredible physician partners. Dr. Eversole is of course one of those and helps lead our medical staff. We've added cardiac electrophysiology and vascular services and surgery, all the way through a licensure designation, which we achieved earlier this year, adult level 1 cardiovascular services, which allows us to intervene. Dr. Eversole is going to talk about what that means. And then culminating in with what is STEMI receiving. And so essentially what that means is we can treat around the clock with specialists a heart attack. That's a huge deal for a community, and literally comes down to a deep mission of ours and yields better outcomes for a community. It saves lives. Literally. Absolutely.
And Dr. Eversole, Florida Coast Medical Center also has recently added the ability to treat deadliest heart attacks. How can this affect the community and improve the population?
Yes, Florida Coast Medical Center now has PCI services for a STEMI, which is an acronym that stands for ST elevation myocardial infarction. And as you said, that is the most serious and life-threatening type of heart attack. It has a very typical EKG appearance, and when that's recognized by paramedics or our ER physicians, it means the patient has a major artery in the heart which is completely blocked or near completely blocked, which therefore causes severe reduction in blood flow and lack of oxygen to part of the heart muscle. And as each moment passes, there's increased risk for permanent heart damage. And there's a saying amongst cardiologists that time is muscle. Right. So there is a procedure called a PCI, which stands for percutaneous coronary intervention, and that's the procedure that opens the blocked artery. And that is performed by an interventional cardiologist in the cardiac catheterization laboratory. And the cardiologist can quickly open the blocked artery with a catheter that typically has both a balloon and a stent. And by opening that artery, we restore blood flow and oxygen to the heart muscle quickly. So the reason why this is so important for patients at Florida Coast Medical Center is it means they don't have to be transferred to another hospital. It means there's no delay in care in our hospital. So that means better recovery from a heart attack and better outcomes, and ultimately it'll save lives in our community.
And I was just going to ask, how is this so significant? Like, how is this being so significant for the community? And you kind of just answered that. We only have a few seconds left, but if we can also just talk a little bit about how this is helping patients manage their health all the way from prevention, diagnosis, and treatment.
Yeah. So heart disease, if we step back and say, is the -- leading cause of mortality. Heart attacks, roughly 800,000 in the U.S. They're very common. They happen once every 40 seconds. They're also the most modifiable, which means that with prevention, treatment, detection, and we do that with capability and proximity, meaning we have advanced the capabilities, and I know we're short on time, so we're close to home. And that's huge. We're the second in St. Lucie County, first hospital in over a decade, second in St. Lucie County to offer this. And we have outpatient offices. We have fast ER times. We can now care for and heal a community.
That is a major milestone. Well, thank you guys for being with us. And if you guys would like to learn more information, we have it all on our website, WPBF.com. You can